Today we have a very interesting surgery for a small dog. She's a female. The complaint was hematuria for a couple of weeks. We did a kind of urinalysis. We found blood, bacterial infection, strovite. Then we did an X-ray, and we found this object on the X-ray. Confirmed that with abdominal ultrasound, and with the ultrasound we found multiple stones. And now we are in the surgery room with Dr. Noor Hashish. He's gonna start the surgery.
This is a cystotomy in a female dog. So my line of demarcation here is the pubic bone. I can feel it with my finger, and I make small incision cranial to the pubic bone in the skin and subcutaneous. Now we are going to cut in the linea alba. And increasing the incision. The bladder should be here. Here it is, right under the It's full of stones, as you see. Can I get 40 Monocryl, please? Yes. And some less sponge, please. Thank you. With some black sponge. Put it around. And can I get the spoon? My spoon. Okay. Away from the blood vessels on the ventral aspect of the bladder, we are going to make our incision. We have lots of urine coming out, and now I expected it will be like pyramidal in shape, yeah?
Yeah, you mentioned that.
Yeah, because it's strovite.
Oh.
Yeah, for the females, what obstruct the female or cause problem for her should be very big stones, because other than that, they pass it.
It is a huge one.
Yes.
Yeah, the mom said she kept trying to go, and I said, well, there's probably not much room in there for urine, so it probably feels like...
Yeah.
Yeah.
It's 5 now.
Now, let me check. Okay, can I get the catheter? And I need Thank you. And I need the syringe, 20 cc. Sterile, yeah. Thank you. And needle, big bore.
20 gauge?
No, bigger. Oh yes, yeah, this one is good. I need fluid. If I have fluid, thank you. Here we go. We have the catheter here, so nothing stuck in the urethra. So that I asked to sterilize this area before the surgery. It will be in our field.
To be sure there is nothing stuck in somewhere.
Yes, press it this diameter, so that's
Oh,
it.
yeah.
And I need more flush, please. Can I get another catheter, please? Any size? 5, whatever. Yeah, whatever. Any size. Thank you.
I think I can see it. I can see it here.
So we flush it retrograde and normograde. And we'll keep this in, inflate it, and take the X-rays after.
Okay.
Okay, now we're gonna close. Bladder. Okay, this one's. Okay. I do it in numbered pattern. Serosa, musculosa. That's my favorite.
Yes.
This is good to release the stress of surgeries.
Yeah. Serosa, musculosa. Flush, please. leakage? Do you see any leakage?
No, there is no leakage.
I don't see any leakage. Yeah. Okay, good. If you see any leakage, we just add some sutures over the leaking
Extra layer.
area. Yeah, that's good. Last time, flush please. Some flush in the area. Some urine. As you see, it's good sealed, so no urine goes inside the abdomen.
Yep.
The opening was small. Now I need what's her weight again? Sorry, her weight.
5.2.
Okay, give me 3015 please. Put it back.
Are you doing the next one, Bassam?
What?
Are you doing the next one, Bassam?
Next one.
Cystotomy?
Yeah, definitely.
Yeah, sure. We are closing the linea alba.
Even if I'm available, I'm enjoying watching Noor.
Thank you. When we open right over the bladder,
Yep.
so this is small incision. It's easier and faster to close rather than to open caudal to the umbilicus and keep searching for it and open and increasing the
Yeah, so you said your mark is the
pubis.
the pubis.
Pubic bone, yeah. Feel it with your hand and
Open
just
cranial.
yes, cranial to it.
It's the same cats and dogs, or just that's in
In the females,
females?
in the males,
Yeah,
in the male dogs, also
we
in the
open-
male cats, you can do it same thing.
Yeah.
Male dogs, the same thing but parallel to
Parallel
the
to the
penis.
previous.
Yes.
Yeah.
The male dogs are. This is the tricky one. Just a little bit
Yeah.
parallel to the previous, and then push it
Push it
to
on
one
the
side and open also in the midline.
Yeah.
In the nail. You can also cut in the muscles, but it's more bleeding, and yeah, I prefer to cut in the
in the
medial.
linea.
Yeah.
I remember the first one I did. I called you. It was in 2016,
Yeah.
and that was your advice to me. Push the penis, then
Yes, it's very easy to push it aside.
yeah, open subcu, reach the linea alba, and
Yeah.
then open in the linea alba.
Exactly. Yeah.
I remember the name of the first cystotomy I did. Yeah, there was a boy.
Yeah.
I think he was Maltese, 12 years old. His name was Caleb.
Oh, yeah.
Yeah,
How old was he?
he was 12
Oh,
or
yeah.
12, 13, and he was volunteer in NATE for ultrasound for the students.
Okay.
Yeah.
Yeah, they found it just by chance.
Yeah.
So he went to NATE for ultrasound, and the ultrasound doctor there found multiple. I remember We did an urine analysis. Urine analysis was clear.
Yeah. Yeah.
So I told them, oh, how come? They asked me to do an X-ray. I did the X-ray. We found 9 stones.
Oh.
Yeah.
But well, actually, they were small, not like today.
Yeah, because for the males, even the small ones can block him.
Yeah.
Block the males. Yeah. Not like the female. The female should be something.
It didn't do anything for him in that time, so he was fine. He was actually, he had lots of other issues, but for the stones, he didn't complain at all. But they found it by chance when they did the ultrasound. And the first cat I did as well. It was the second surgery to him. The first was by Noor.
Oh, yes.
Noor did the BU for him. Then he was blocked multiple times. Then couple of years later, he came back because he has a hematuria. Then we did a urine analysis. Urine analysis was normal, like just blood, red blood cells only.
Yeah.
No infection, white blood cells, okay.
Yeah.
No crystals. But we asked Noor to do an ultrasound. We found a stone.
Okay.
Yeah.
Yeah. You don't always get crystals, right?
Yeah. Since then, I tell the owner, if we did not find crystal in the urine, that doesn't mean there is no stones.
Exactly.
Yes. There is crystals, may not.
Yeah.
There is no crystals, may not.
Also, sometimes when you keep the urine sample for a long time, before the analysis, the crystals got dissolved.
We had a male dog once. That's why I asked like pre and post X-rays because he had come in like the day before, and then when they went to do the surgery, no stones in the bladder.
Yeah.
They had all gone into the urethra.
Unfortunately, that was my first cystotomy.
Yeah.
After we opened, I didn't find the stone.
Yeah.
Then I kept flushing from outside till it's like float, and I collected them.
Yeah.
For this
It was a
reason,
bad luck.
for this reason, I flush retrograde and normal
Yep.
grade to be sure that there is nothing stuck, especially with the males.
Especially with the males. And if these are small, not like this size, with a big urethra, they may fall down.
Yeah.
Would you set up the X-ray, please?
Sure.
Thank you. Just laterals. I can do both, but
Okay.
one.
This is the post-operative X-ray. As you can see, this is the demarcation of the bladder and the catheter, urinary catheter inside. So there is no stones in the whole bladder. Hope you enjoyed the surgery. Thanks, Dr. Noor, and see you for the next one. Bye.